Teachers and experts from Griffith University in Australia organized a training for trainers in emergency medical services to strengthen the skills of emergency responders. The training was attended by paramedics, emergency rescuers, and police officers in Ulaanbaatar and several provinces.
EMS training will continue for 10 days. More than 70 professionals who attended the training will receive emergency medical service trainer certification. They will be able to return to their communities and organize training on handling emergency medical situations.
The 10-day training covers what care first responders should provide to people in emergency situations. Paramedics from Ulaanbaatar and the provinces are participating in the training.
Nalak district is located on a main road, and the Tirilj area is frequented by visitors and hikers, so we often have emergency accidents such as people falling from cliffs and rocks. Paramedics often provide first aid before transferring people to the trauma hospital. Emergency responders and rescuers in developed countries are trained to deliver life-saving first aid. Paramedics are also required to have the ability to put out a fire and other skills for working in emergency situations.
In 2017, I visited Mongolia in the north of the country in winter, and I observed that the ambulances that were being used were quite old and required some equipment. So I returned to Australia and contacted a colleague who was a paramedic, and we both then started this project to improve Mongolia's EMS service nationally, starting with UB and working out from there and Seleng province. What we suggest is that the government of Mongolia look at improving emergency medical services or ambulance services for the people of Mongolia. Improving those services means that patients will arrive in hospital in a much better condition, being better treated by doctors who have equipment and training. So part of our project is providing that training that they would not potentially get in their studies at university. So coming out of university and then being trained in pre-hospital care with better equipment means more lives will be saved in Mongolia.
So one of the things we have done as part of this trip is we've been able to work with LifeFlight, one of the leading aeromedical providers that is in the state of Queensland where I come from. And they've provided us a heap of training equipment or expired equipment that they can no longer use. Now, I know how new aeromedical is in Mongolia, so we've brought that over so we can give this equipment to NEMA so they have new equipment to train with. So this saves NEMA money using equipment that they could use on patients, so using old equipment for training. And what's key about developing aeromedical anywhere is that the people providing it, so your doctors and nurses, have equipment so they can practice training. So when they go out to an incident, they're working really well. And it's only with repetitive training can you improve your service.
Rescuers, police, and paramedics play a crucial role as first responders at the scene of an accident. Those first on the scene when someone is in a life-threatening situation must have the skills to administer immediate and effective first aid. Studies show a 70% correlation between the timeliness of delivering first aid and the person's chance of survival and overall quality of life.